two long-serving members of staff. We now have Danielle Mayhew-Bradley, who is a bit further, more fresh in terms of her career.
Hi, my name's Danielle and I'm currently working as a Trainee Nursing Associate on Shipley, which is in healthcare at the elderly ward. I started my career in a nursing home as a healthcare assistant the day after my 18th birthday, as nursing is what I wanted to do from a young age. After 6 months working in the nursing home, I wanted to learn more about being a nurse in the acute setting. In 2006, I was offered a job at Derriford Hospital. I started on a healthcare at the elderly ward where I learnt so much about patient care. This is where I knew I wanted to continue my career and develop my career in nursing. Within the ward I was working, there was many inspirational healthcare assistants and nurses, and throughout my career I've met many nurses that I look up to and hope one day I may just be like them. The knowledge and skills they have gave me the drive to develop my knowledge, and so I could give patients better care and a better journey throughout their stay in hospital. I then chose to make a change in my career to develop myself further as a healthcare assistant by getting a Band 2 healthcare assistant job within the emergency department. Whilst working in the emergency department, I achieved my healthcare assistant level 2 and level 3 course and gained many extra clinical skills. My experience and knowledge developed as a healthcare assistant. This enabled me to continue my career progression by gaining a Band 3 post as a doctor's assistant within the acute care team. From there, I continued to progress, and I was extremely privileged in January 2017 to be part of one of the first pilot schemes for the Nursing Associate. Derriford is one of the 11 pilot sites across the UK, and I was able to be part of this new programme. I've had 12 years experience working in the NHS, and I've worked in many areas. Throughout these areas, I continue my education in healthcare through the healthcare assistant courses and access to nursing course, and gain many clinical skills such as cannulation, catheterisation, venipuncture, ECG training and plastering. During the 2-year pilot programme to become a nursing associate, throughout my training I have cared for patients in an acute medical ward, surgical ward, a healthcare at the elderly ward, and this has given me in-depth and breadth of knowledge dealing with patients with multiple conditions and different patient journeys. Whilst on these placements, it has given me the experience to enhance my knowledge from a healthcare assistant to a registered professional by receiving academic learning through multiple ways: lectures, assignments, presentations and clinical skills. Consequently, I'm able to apply the knowledge that I have learned and put into practice that I undertake, giving my patients better patient-centred care. I'm now a final year trainee nursing associate, currently about to complete a foundation degree. And without these opportunities that the Trust has given me, I would not have been able to develop this far. I would like to continue my career path to become a registered nurse, as I am committed, dedicated and motivated to achieve the BSc degree in adult nursing. The last 2 years have seen me dedicating myself to my training, enabling me to become more competent and a skilled nursing associate. Therefore, I want to take these attributes and use them to become a registered nurse. Currently working in the NHS, I have the knowledge and the understanding of the current pressures on the workforce and understand the limitations and difficulties of recruiting into nursing, making this opportunity all more valuable. The insight I have, being in the NHS already, strengthens my reasoning for wanting to be a registered nurse, and I aspire to provide the best nursing care to patients. I am keen to continue learning and working alongside the multidisciplinary team and to share their knowledge, but I'm also keen to further my own professional responsibility through becoming a registered nurse. This has therefore been given me the drive to continue my training and develop my knowledge further. I've been extremely lucky, alongside 7 others within the Trust, and have been offered a place on the Nursing Apprentice programme starting this year. This will allow me to fulfil my dream, and at the end I'll become a registered nurse. I think all of us have fears and concerns going into the Nursing Apprentice programme, as did I when I started the Trainee Nursing Associate programme. The Nursing Apprentice programme is a different route into nursing. We have gained knowledge and experience by different routes compared to the student nurses. However, we will all have the same qualification at the end, and we will both work together to be registered nurses to achieve a high standard for care for our patients. Change always comes with concerns, and this can be because of the lack of understanding. This happened when I started as a nursing associate. There was a lot of negative thoughts of the role, but this has now changed, and the understanding of the role is better. How the nursing associate will be used and that no other nursing role is at risk due to the nursing associate coming in, and that each nursing associate will also be regulated by the Nursing and Midwifery Council. Therefore, as one of the first nursing associates in Derriford, I've learned to be resilient and to change people's opinions on the nursing associate role. Within the NHS, by educating and informing people about the role, this will benefit myself when facing possible challenges about the differences between the nursing apprentice route compared with the normal route into nursing. Alongside training to become a nursing associate, I was also nominated as class representative for Derriford within the cohort. During this role, I've been able to promote the nursing associate role through presentations and take part in the International Nurses Day. I've enjoyed my journey into nursing, and it's great to see that there are more and more training nursing associates following, and hopefully more nursing apprentices next year. I look forward to starting as a nursing apprentice in the next couple of months and feel really extremely privileged and grateful for being given the opportunity to become a registered nurse in the future. Without these opportunities, I would not have been able to develop as far as I have. I will be forever thankful for my journey and fulfilling the dream of being a registered nurse.